And as I said, so last evening, we worked late, and then this morning, before I came here, we worked again. And so right now, I'm hoping that the distribution plan for those suits is being finalized, and I'm actually hoping that they're going to go out to the stations today. They also have about training, and it's the other component that they're trying to get together, and whether it's going to be by memo or by video or is any other training, that's what they're trying to figure out how they can most quickly get that done. But I'm hoping that they will hit the stations. I'm hoping today.
Mayor, can we get an estimate of the timeline of when this is going to be rolled out and what we should expect to hold, not to you know, just, it's very important that we understand what the expectations are, the timeline that they will be rolled out in the hands of the firefighters. Also, if we could you help me understand too, we talked about circulars and how that gets out and the information. What accountability do we have at the ground level that that information is there and they know what to do with it? Also, when you're saying that this is the fluid, the bodily fluid, is how it's transmitted, my other concern is when we take temperature by mouth, are we going to make this another issue? Make it worse? Is there equipment that, as my colleague Councilman Bradford said, is there equipment that we could use that might make that lessen the exposure of the bodily fluids and the chance, because we don't know who they're approaching and where they could have flown into Dallas and been here in a day, and we wouldn't know where they came from. So we've got a lot of what ifs, and then I think it's very important to understand also, in a large district such as mine, it's far away from the medical center, but now with my new West Houston Medical Center over the west side, but the fact is, where are you instructing firefighters to transport? Where are they going to transport to? And I want to make sure that because we know we have different levels of service at different brick and mortar facilities. Can you answer those questions?
Sure. The first question about taking a temperature, you're right. The fire department has thermometers today, but they are the ones they're electronic thermometers that you put your mouth. And so our discussion last night and this morning was to replace those basically the strips that go right on the forehead and are one-time use and can be disposable. Remember, in the field, we just need to know whether they have a fever or not. We don't need to know exactly what the value is. So if there's a little bit of inaccuracy with those, that's fine. And let me just also add, in this whole thing, there's a lot of mixed messages and confusion. So let me just get to one right now, because if you haven't figured it out yet, you're going to. So what is a fever? So if you go to the dictionary or medical dictionary, they generally say a temperature of 100.5 or greater. If you go to the CDC, things they put out about Ebola, it says 101.5 or greater. And if you go to the Texas statutes, it says anything greater than 100. So the official paper that's coming out from the state with their quarantine orders, they use the state-defined temperature of 100 or greater. And quite honestly, if somebody's in quarantine and we're waiting to see if they develop a fever, at which point we're going to do something, I'm happy that it's 100, because once you hit 100 and your temperature's going up, we want to know as early as possible. So I don't think it's a problem. But I just point out that there are some mixed messages that are in this, and there's no malice of intent. It's just the way it is. So we're looking to get, hopefully they're going to be putting forward a purchase order to get the thermometers that you just put on the scan and give you a quick idea if it's fever or not. And then your second question was?
We have the transport issue.
Oh, transport.
And then the rollout of down to the...
Yeah, so the CDC has said that basically any hospital that has isolation facilities, which is pretty much every acute care hospital, should be able to take care of an Ebola patient. They have also said as of yesterday that now rethinking that, and that they may try to identify certain hospitals within communities that would be the facility to take care of it. That has not occurred, and there'll be a lot of ups and downs with that. So today, the fire department we will transport patients to hospitals based on the way we usually decide. And that is, if the patient's critically ill, you're going to go to the closest hospital that we think has the capability to take care of your illness, regardless of where you want to go. And that causes problems sometimes, as you know. If the patient is stable, we will try to get them to the hospital that they choose, again, if the firefighters think it's appropriate. So we wouldn't take a trauma patient to a non-trauma center hospital. But we do try to accommodate the patient's wishes. And then finally, if the patient, for example, is somebody from out of town they don't really know, then the firefighter will use their best judgment to try and get them to a hospital. I suspect that while we don't have anything in policy, just knowing our firefighters, that if we've got somebody who they think has Ebola, they're going to try to push him towards one of the larger hospitals. But there is not an Ebola hospital in Houston at this point. I've talked with representatives from all the big hospitals. Everybody's nervous that they're going to get a patient, but they're also said if it comes to us, we're going to take care of it. So everybody's stepping up to the plate. They're just hoping they don't get a case.
still have time?
Yeah, it passed, I already rang it.
Sorry.
Nobody's paying
I asked that
attention to.
question.
Okay, I'm sorry, the
The
rollout.
rollout to the front line,
So, yeah, so
accountability for the information.
So the accountability, I'm a little bit out of my lane answering that question. That's really a fire chief and police chief question. I provided the information and coach them on how to do it, but in terms of accountability, that's not my responsibility that I don't think is important. I'd be out of my lane if I really tried to talk about accountability for firefighters.
Dr. Persse,